Okay, ku nshuti za Kabagema TV, uyu munsi tugiye kubigisha ibigendanye n'uburyo wakora first aid wibereye mu rugo. Tugiye kubereka mu buryo bugera nko muri butatu cyangwa se bune. Impamvu barakwereka nk'igihe umwana yaba agize ikibazo, yenda abuze nk'umwuka, agize umwuka mukeya, mu gihe utarahamagara ubufasha nko guhamagara 911, urasabwa ko nibura uba uzi gukora ibi bintu by'ibanze tugiye kubereka muri iyi video, muze kuyikurikirana mwitonze. Ikintu tugomba kubabwira rero ni uko mbere kugira ngo ufashe umuntu mu rugo, mbere na mbere ugomba kumanza ugomba kumenya ko nibura impamvu iri kubitera ukamusuzuma. Niba ugiye ari umwana mutoya ukoresha intoki ebyiri, byaba ngombwa ukaba ufite n'ibikoresho mu rugo bya first aid. Yari umuntu mukuru ukoresha ibiganza bibiri ugenda ubikanda, muraza kugenda mubibona muri video. Ikindi ugiye kuba mbere yuko kugira ngo ube wakongera umuntu umwuka ukoresheje umunwa ku wundi, ni uko ubanza wumviriza ukamenya ese uyu muntu ari guhumeka cyangwa ntari guhumeka. Icyo gihe bituma wamenya ngo uyu muntu ngiye kumufasha, mwongerera umwuka nkoresheje umunwa ku wundi. Uragenda ureba n'ibikoresho bimwe na bimwe byabugenewe bigenda byakurinda kugira nawe bimurinde mu gihe mwembi yenda mwaba mufite ibibazo by'uburwayi bw'ubuhumekero ariko ukaba ushaka kuba wamufasha. Ni uburyo bwiza bwafasha abantu bari muri ibi bihugu, dore ko kwirinda biruta kwivuza. Ni na byiza ko rero twese tugenda tumenya uburyo bwinshi bwadufasha, bitari ngombwa ko umuntu w'umurwayi yaducika kandi turi kumwe nawe mu rugo. Murakoze, mukurikirane video mwitonze, iri mu Cyongereza. Tuzagenda tubibagezaho gahoro gahoro, tubabwira uburyo mwagenda mubyifatamo nuko mwakwirinda. Murakoze.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 4, 5, 6, 7, 8, 9, 30. Head tilt, chin lift. Breath. Breath. And keep going. If this takes 4 hours because you're laughing about it, it works for me. I'm here all night anyway. What? Well, we're going to go over that here in a minute, too. Breath.
You keep going?
Keep going. Getting tired yet. It's only been like 40 seconds.
If the casualty is unresponsive, call for medical aid and an AED if available. Open the airway using the head tilt chin lift. Check for normal breathing and a pulse for at least 5 seconds, but no more than 10 seconds. If the casualty is not breathing or has abnormal irregular gasping breaths, start CPR right away. Ensure the casualty is face up on a firm, flat surface. Then position 2 fingers on the breastbone below the nipple line. With 2 fingers, compress the chest at least 1/3 of its depth, or about 4 centimeters, in a smooth, rhythmic pace at a rate of 100 to 120 compressions per minute. Be sure to allow the chest to fully recoil from the compression. Give 2 ventilations with just enough force to make the chest rise. Take care not to overventilate and force air into the casualty's stomach. CPR is continued until an AED can be applied, the casualty begins breathing again, medical help or another rescuer takes over, or the first aider is too tired to continue.
Second, by sharing the task of compressing the chest, 2 rescuer CPR allows for a team to perform effective chest compressions for a longer period of time. Finally, 2 rescuer CPR minimizes the time the compressions are interrupted for ventilations to be given, and allows the rescuers to give feedback and support each other during a stressful episode. If a 2 rescuer team arrives at the same time, the first rescuer will send a bystander to call 911 and begin a primary survey, while the second rescuer prepares to deliver chest compressions. The second rescuer will deliver 30 chest compressions, counting out loud. After 30 compressions, the first rescuer will deliver 2 breaths. If there is no bystander, the second rescuer will go to call 911. When they return, they will take over at the direction of the first rescuer, usually starting with the compressions, since the second rescuer is fresh. Together, they will continue to deliver 30 compressions at a rate of 100 to 120 compressions per minute, and a depth of at least 5 centimeters or 2 inches, followed by 2 breaths. After 5 cycles or roughly 2 minutes, the rescuer should change places after the breaths have been delivered to keep the compressor fresh. CPR should continue until an AED can be applied, the casualty begins breathing again, medical help or another team takes over, or the team is too tired to
Turn on the AED and follow the voice prompts. If the AED is equipped with infant pads, follow the images on the pads. If the AED only has adult-size pads, place 1 pad on the front of the infant and 1 on the back. Follow the prompts of the AED, making sure everyone is clear of the infant while the AED analyzes and/or shocks.
Analyzing heart rhythm. Shock advised. Charging.
I'm clear, you're clear, everybody's clear?
Deliver shock now. Press the orange button now.
1, 3, 1, 2, 3. Shock delivered. 1, 2, 3.
If the shock does not result in the infant breathing, or if no shock is advised, resume CPR.
The case will turn it on. The rescuers now follow the voice prompts.
Remove clothing from the patient's chest. Open packet and apply pads onto patient's bare skin.
Bare the chest. Dry the chest if necessary. Look for the pediatric electrodes in the AED. Peel away protective plastic and attach electrode pads according to manufacturer's directions. Stand back and make sure no one is touching the casualty.
Press the shock button now. Shock delivered. Begin CPR.
Give CPR on command of the machine. If the AED detects a shockable arrhythmia, it will prompt the rescuers to enable the shock. Continue to follow the voice prompts until the casualty begins to breathe on their own or until medical aid arrives.
Respiratory emergencies like suffocation or choking can produce respiratory and cardiac arrest. If the casualty is unresponsive, this is a life-threatening medical emergency. Call for medical aid and an AED if available. Once help is on the way, assess for life-threatening conditions by performing a primary survey. Open the airway using the head tilt, chin lift, and check the mouth for anything loose. If the casualty is not breathing or has abnormal, irregular, gasping breaths, start CPR right away. Ensure the casualty is face up on a firm, flat surface. Then position 2 fingers on the breastbone below the nipple line. With 2 fingers, compress the chest 30 times. Compressions should be at least 1/3 of its depth, or about 4 centimeters, and delivered in a smooth, rhythmic pace at a rate of 100 to 120 compressions per minute. Be sure to allow the chest to fully recoil from the compression. Give 2 ventilations with just enough force to make the chest rise. Take care not to overventilate and force air into the casualty's stomach. CPR is continued until an AED can be applied. The casualty begins breathing again, medical help or another rescuer takes over, or the first aider is too tired to continue. Because CPR alone is more effective at resuscitating an infant, it is recommended that CPR be performed
directly above the heel of the hands. Give 30 compressions straight down on the breastbone. Compress the chest at least 1/3 the depth of the chest, or about 5 centimeters or 2 inches. Be sure to allow the chest to fully recoil from the compression. Look in the mouth to see if the obstruction has been dislodged. Remove it if you can see it. Give 2 ventilations with just enough force to make the chest rise. Take care to not overventilate and force air into the casualty's stomach. If the chest doesn't rise, reposition the airway and try again. You may have failed to open it properly the first time. Continue chest compressions. Chest compressions and attempts to ventilate are continued until the casualty begins breathing again, medical help or another rescuer takes over, or the first aider is too tired